Hello everyone, we are Group 7. Today we will talk about some common injuries you can get when you play football, why they will happen, and how to prevent them. Firstly, let me introduce our group member first. They are Zhang Xiuqi, Zhang CHENHE, Li Renfei, Chen Jingyang, Cui LUYUAN, and Wei ZIHAO. For the introduction, football is a fast and hard game. We run, turn, jump, and hit other players, so getting injured is common. In our group, each person covers one body part. I will begin with the ankle, and then we move up to the leg, knee, and calf, and so on. Because the ankle works the hardest, let's start there. The ankle is the joint that lets your foot move up, down, left, and right. It carries your wall weight when you kick or land. So why does the small joint get injured so often? Now I will introduce why ankle gets injury mostly. Because quick turns, a walk landings after a jump, stopping on someone's foot. To prevent these injuries, warm-up will do small ankle strings moves, wear good shoes, and use tap or brace if you had old springs. This action leads to streaming kind of ankle injuries. So I will introduce some common ankle injuries. First is sprain. Brand inside the ankle strings or tear. Next is break. A bone cracks after a hard fall or trickle. Second is core tendon. The core at the back of ankle swings from too much running or bad shoes. If any of these happened, what should we do? So for this page, I will introduce some treatment methods. For a light sprain, use RICE to raise the ice compression and aeration. If the pain is seriously, we need to see a doctor. You may need to special exercise or even an operation. Getting better can be a few days for a small sprain or many weeks for a break. A real case study makes it clearly. Next, I will introduce. Lastly, I will introduce a real cases about Neymar's ankle injury. In December 2021, Neymar switched her left ankle in a PSG game. A scan showed damage to the brain the inside, so he rested and did rehab. He came back after 6 to 8 weeks. This shows even top stars must give the ankle time to get better. That's all about the ankle. Let's move up to the team and king injuries, which my teammates will explain. Thank you.
The second part is the size and knee injuries. First, the quadriceps muscle function to extend the knees, joint, and players are co-driving roles in running, jumping, starting, stopping, and ground stabilities. When football players perform high-intensity jump and excessively high-speed sprints, they need to withstand huge instantaneous sessions. Injuries are easy to occur when the joints are abnormally persistent due to the accidental fall to be input. Symptoms include the persistent pain in the front side immediately during exercise, weakness or pain in knees extension after walking, running, jumping, and normal training. The conduct muscle function to adapt the height and the participations in running, changing directions, and controlling the balls. When athletes moving sideways quickly, slide defensively, and extend their legs with a long stride, the conduct muscles are stretched too long, and extensive tension causes strengthens. Its symptoms are acute pain accompanied by tearing sensations, and pain during leg movements cause discomfort when walking and standing. In the knees, the meniscus is a fibrous cartilage located in the knee joint, and its main function to the buffer pressure and stabilize the joint. In high-intensity sports such as football, suddenly changed in the direction cause the knees to rotate sharply, causing the meniscus to be sheared and squeezed and torn. The cruciate ligaments in the knee joints are divided into anterior and posterior cruciate ligaments, which together maintain and retain control of the knee joint. When change of direction and steadily sports, Their feet are nailed to ground which easily lead to the carpus of the cruciate ligament. Patellar tendinitis is a degenerative change caused by repeated stress in footballs. Athletes jump down with high intensity when shooting and hiding, and long-term overtraining are competitions. Due to insufficient recoveries, the accumulation damage eventually produced inflammation. Here are some examples for related injuries among football players. Mbappe suffered a quadriceps tear, ending the season early in 2024 years. Earlier in the same years, Messi felt discomfort in his adductor muscles and developed the edema during the game. Neymar fell to the ground after the collision with the opponent in the World Cup, tearing his cruciate ligaments and meniscus. Martinez was diagnosed with a torn anterior cruciate ligament after the collision earlier this year. When the side is injured, short-term assistance with medicines, gentle dynamic stretching, and the post-gassive contraction exercise. Intermittent lateral sprints, jumping and change of direction training. Consecutive treatment is recommended and commonly used for knee injuries, including as compressions and elevations to reduce swelling. Rest to avoid the aggravating knee twisting and weight bearing. Gradually carry out rehabilitation trainings. Common preventive measures are warm up fully before the games to relax muscles. Arranging training properly to avoid the excessive correlation of fatigue. Strengthens the technical specification of movement and equipment sessions. Ensure sufficient energy intake to promote recovery of injured parts.
Third is the foot injury. First is a metatarsal fracture. This is a broken bone in the foot. In football, it can happen because of a strong hit using your foot too much or landing the wrong way. It often happens in the face metatarsal, the long bone on the outside of the foot, especially a tab called the joint fracture, which takes a long time to heal. Preventive suggestion: wear football shoes that fit well and give good support. Second, don't suddenly increase how hard or how often you train. Do exercise to make your lower leg and foot muscle stronger and more flexible. The second foot injury is plantar fasciitis. Plantar fascia is a thick tissue that connects your heel to your toes. It supports your foot arch and helps to absorb shock. If you run a lot, play on hard fields, or play too much, this tissue can get small tears and become inflamed. Preventive suggestion: always warm up and stretch your foot before training. Second is avoid training too long on hard ground or artificial turf. Third is change your one or sports shoes every 6 to 12 months. Third foot injury is interphalangeal joint contusion. This is a bruise or injury to the torn joint. It usually happens when your toe is hit by the ball step on, or you missed a kick or twist your toe too much. The injury affects soft tissues, ligaments, or the joint. It often happens in the big toe joint. Preventive suggestion: first is wear prepare shoes with an arch sole. Second, don't kick the ball barefoot or wear shoes that are too soft. Third is do exercise to improve your tone, strength, flexibility, and balance.
Everyone, I'm Jinyang. Let's talk about the first part is the heart injuries in football. The heart include a big problems in football. They hope often for hurling the ball or crashing into other players. They can cause concussion, broken bones, or even brain damage. Making the game soft is now a big focus. Some, some common injuries include concussion, brain injury for impact, skull fracture, broken bones, or heart headers, and focal injuries like a broken nose, repactor head can even lead to long-term brain damage called CTE. Even famous players get hurt. Patrick, a goalkeeper, broken his skull in 2006. He comes back with a Spanish helmet, and his course helped improve safety rules. Cristiano Ronaldo has hurt and even injured in 2012. This year, even top players focus face risk to prevent injuries. We need tractor rulers like no inburst to then hand can shoot hard the ball less in turning. Gatekeeper should wear helmet and we need focus medical check down games. Heart injuries can end crosses. We need better protection. Remember, safety is more important than warming. Thank you.
Next is upper limb injury. In a football match, although the upper limbs do not direct participants in ball control and running, they can play a significant role in defense. This process is very likely to cause injuries to the arms and fingers. Song fell down after colliding with an opponent and used his arm to support himself, resulting in a fracture. This was a significant upper limb injury in his career. Benzema suffered a fracture in his hand bone during the match against the Real Betis, but it did not affect his performance. Messi fell down while fighting the opponent. He supported himself with his right hand, which caused improper focus on his forearm, resulting in a fracture of the radius bone. He was in great pain at that moment and was immediately substituted off the field. In terms of prevention, one should learn the correct way to fall and keep the arms drawn in during the confrontation to reduce the risk of being directly hit. Conduct repeated forearm muscle training to enhance the ability to resist intermediate levels of focus. If there is a mild injury, you should immediately use anti-inflammatory drugs and wrap it with an elastic bandage to prevent swelling. In case of fracture, immediate flexion should be carried out and the participation in the competition should be prohibited to prevent further injury.
Hello everyone, today I will talking about calf injuries in football, which are quite common, especially during intense matches or training. Calf injuries often occur when a player sprints suddenly, changes the direction, or kicks the ball forcefully. These actions can strain or tear the calf muscles, especially the gastrocnemius or soleus. To prevent calf injuries, it's important to do proper warm-ups and stretching, especially for the lower legs. Also, improving muscle stress and flexibility, staying hydrated, and avoiding overtraining are the key strategies to reduce risk. There are several types of calf injuries. The most common one is calf strain, which can be mild or severe depending on the muscle tear. Sometimes ligaments may overstrike, or even bones around the ankle may fracture due to high impact force on tendons. In some cases, Achilles tendinitis can occur from repetitive stress or poor ankle stability. For mild injuries, we use the ICE method: rest, ice, compression, and elevation. If the injury is more serious, players may need physiotherapy and a gradual return to training. For recovery time can range from a few days to several weeks, depending on the severity. Here is a real example of calf injury recovery. In October 2022, Messi had a minor calf problem while playing for PSG. He missed only about 9 days thanks to early treatment and proper rest. The PSG medical team used physiotherapy and reduced his training load. He returned to play on October 13. This shows how important fast diagnosis and professional care are in helping players recover quickly from muscle injuries. Our speech is finished. Thank you for your listening and watching.